So, good evening, everyone. Today, we are extremely privileged and grateful because we have none other than Dr. Mandira Saha Mallik with us. I would like to introduce ma'am. Um, she began her career as a non-academic JR in the Department of Pulmonary Medicine in North Bengal Medical College and Hospital. And then she started working as an RMO in Netaji Subhash Chandra Bose Cancer Research Institute, Kolkata in 2013. And then she began to work in Tata Medical Center as a clinical fellow in radiation oncology. Then she became the specialist medical officer in oncology in ESI Hospital, Shialda in Kolkata. Then she became the clinical fellow in Tata Medical Center, Kolkata. After that, she became the junior consultant at HCG Echo Cancer Center, Newtown, Kolkata in the year 2020. Then she became the consultant in radiation oncology at Hemlata Hospitals and Research Center, Bhubaneswar, and presently she is working as an assistant professor radiation oncology at Kalinga Institute of Medical Science, that is KIMS, Bhubaneswar. So recently she is working there, and she is an MBBS MD radiotherapy gold medalist DNB radiotherapy. So today we are extremely privileged that she has managed time from her extremely busy schedule, and she is here with us to enlighten all of us about breast cancer awareness, which I am very much sure that all of us women are very much not familiar with how to be aware at a very lesser age, because according to, I was going through a recent report published by AIMS Delhi. So they said that even women under 40, there is a 30% rise in the incident rate of breast cancer in women under 40. So it's a highly alarming time, and we all should be extremely aware about how to be, how to increase the awareness among all of us. Not like, it's not that after a certain age we should be very much protective and aware, but now there is no age limit. It can come at any age. So I would request Dr. Mandira Saha today to enlighten us in a limited time she has. So I will request her to begin her seminar and to start her presentation.
Thank you, Shastika, for a beautiful introduction. So let me share this screen first. Okay, you have to enable because I'm unable to do it. Host disable participant screen sharing.
Can you share now?
Let me, yeah. Okay. Is it visible?
Yes, ma'am.
Okay. Then just.
Ma'am, you can just make it full screen so that you can just press F5.
Yeah. So now is it visible clearly?
Yes.
Okay. So now I'm not going in details about introduction and all. So I'll go into the topic first. So today I'll tell you a few facts about breast cancer, which all of us need to know, all the women, men, everybody. So this is, and we are doing this because this month, October, has been designated as a breast cancer awareness month. And it was started long back in 1985. Since then, it was continuing. So now, before going in all the details, I'll tell you about what is cancer. All of us, more or less, we know about what is cancer, but still I'm telling you a few words about these things. That the part of our body or any cells in our body, when started to grow uncontrollably or abnormally, and when they have tendency to spread to the other part of the body, and eventually what they do, they just destroy that organ and cause death. So that's why cancer is a fearsome disease, and it is increasing day by day. Now if you see the statistics, how it is increasing, now it has already taken the second position. First disease is heart disease. Now cancer is second most commonly occurring non-communicable disease. So you can see the incidence is increasing day by day. We all have to be very much aware about this cancer, because its treatment in advanced stage cancer treatment is still not that much satisfactory. Survival is not so good. So we have to be more careful. And regarding breast cancer, now the situation is very much alarming, because in few years ago, lung cancer was the first most common cancer, but breast cancer has taken the first position in within 2 to 3 years among both gender, among male and female. Breast cancer is the most common cancer in worldwide as well as in India. And in India, mortality wise and prevalent wise also, breast cancer is the number one. Now, if we see these statistics in 2015, sorry, the per year breast cancer detection was around 1.6 lakhs. Now in 2020, it has increased in 1.6, 1.7, and we are expecting that by 2025, it will be around 2 to 2.5 lakh new case will be detected per year. Now I'll tell you a little bit more about the worldwide data. That worldwide it is the commonest cancer, though 1 in 8 female in North America, they develop breast cancer, but in India, 1 in every 28 female will likely to develop breast cancer. At present in India, 4.5 lakh women is suffering from breast cancer. And in last few years, if we see that between the age of 25 to 50 years, what Swastika was saying a few minutes ago, that it is increasing the incidence in the younger age group. And that is also very bad, because in younger age group, the cancer is more aggressive. Treatment is more complicated. So we have to be aware, because breast cancer is potentially curable disease if we detect it in early stage. That's why in Western country, if we see the data, that the survival is very high, because North America and Europe, they are very much concerned about this disease, and they are all aware of this disease. They are doing the screening timely. So breast cancer is detected in very early stage. So the cure rate is very high, approximately 90%. But in India, still there is lack of awareness and screening program. So still in India, the survival is only 66%. Now, before knowing about the breast cancer, you should know that what you have to see. What are the symptoms of breast cancer? In early stage or initial stage, most of the time it is asymptomatic. That's why we have to do the screening, so that we can detect it in that stage, in very early stage. But when the symptom starts, it is usually a painless lump. You just remember painless lump. Okay, that is the commonest symptom. But the other symptoms, which is usually appears in the advanced stage, like skin changes, PUD orange means skin will be like orange peel-like skin, redness, nipple excoriation, retraction, scaling, eczema, skin ulcer, distortion of the breast, or swelling in the armpit. Now I'll show you a few pictures of breast cancer. The first picture, there is swelling, second upper right side, that is swelling in the armpit, and this is the PUD orange, that skin has become like orange like skin, ulcer, and skin dimpling. All these symptoms are the symptoms of advanced stage, not the early stage, but still you should know about these things. Now, why we are giving so much importance to screening? Because it has been proven that if we detect it in early stage, it is almost 100% curable disease. And we always estimate survival for breast cancer is 10 years, 20 years, not less than that. So to fulfill these things, we have to start screening. So why in India survival is so low? Because most of the patient doesn't know about the cancer, so they come to us in advanced stage. There is lack of awareness, poor screening, and all these things. And what are the parts of the screening program? The main is clinical breast examination and mammography. And other few associated things is self-breast examination, breast ultrasound, and breast biopsy. I'll tell you one by one. Now coming to the self-breast examination. Self-breast examination is when someone is examining herself or himself, because breast cancer is happening in male patient, male person. So everybody should do, mainly for females, that self-breast examination, when any female person will examine her breast by herself. And how will you do it? This self-breast examination should start just after the age of 20 years, so early. And it is usually done on the third or fourth day of period, because that is the fourth day of menstruation or periods, whatever you say. So that is the time when breasts are least engorged, least swell. So at that, how will you do it? You will do it once in a month, and you will do it in front of a big mirror if possible. First, you will undress yourself, then you will stand in front of a mirror and look at yourself. And first, you will square your shoulder and put your hands on the hip. And first, you will check the shape and size of the breast and any changes in the skin, dimpling, or any changes in the nipple areolar area, and all these things. Then you will do the same thing by raising your hand. I'll show you the position. Okay. First, you can do it at the time of shower also. So first you will put your hands on the hip, then you will raise your hand, then you will check one breast at a time. So your left breast with the right hand and right breast with the left hand, either lying down position or sitting or standing position, any position you prefer. So how will you palpate it? How will you feel your breast? So first you will start from the clavicle to stomach, and from armpit to the cleavage. All the tissue will feel with the palm of your finger. You will put your fingers firmly and on your breast, and with the palm of your finger, you will feel the tissue in a circular fashion, one by one. Okay, and if you find anything unusual, any lump or anything, if you feel, then definitely you should talk to your doctor. Now, just who should get this screening? So in female patient, any female population, for breast cancer, there is no low risk group. Everybody, all of us are in the average risk group. So everybody should undergo with the screening procedure. There are some other group that is called high risk group, and other general population come under average risk group. There is no low risk group. So everybody should undergo screening. And why it is so important? That multiple trials have shown that the mortality due to breast cancer has decreased after screening up to 20%. And in recent studies is showing that it can be decreased up to 40%. So we should continue this screening program very stringently. Now, when this screening should begin? So this has changed few years ago. Initially, it was that the screening should be started after the age of 40 years. But now, multiple studies are saying that it should be started at the age of as early as 25 years. Because in India, the younger age group is affecting by this cancer. So at the age of 25 to 40 years, every 3 yearly, every female person should undergo clinical breast examination. But that clinical breast examination, what does that mean? That means you should undergo screening procedure in a center where they are running this screening program, not by any doctor or any surgeon or anybody. So, and because this clinical breast examination include multiple other things, like that doctor will tell you about the disease, about the symptom, about the risk factor, how you can avoid those risk factors, as well as full history taking and examination. So you should do in a oncology center where this screening program is going on. So every 3 yearly, everybody should undergo from the age of 25 to 40 years, every 3 yearly clinical breast examination. Then after the age of 40 years, there will be annually clinical breast examination and mammography. Hello.
Trisha बोली मैं दूसरी जगह Trisha का जॉब नहीं लगा
Please mute your mic.
Whoever it is, please mute yourself.
हेलो आज मैं सिल्क बोर्ड के पास में कहाँ पे है?
Yeah, ma'am, now we can carry on.
Oh, yeah. Okay. And another important thing is awareness about breast cancer. And you should know about the high-risk cancer patient who has the risk of breast cancer more than 20% as compared to general population. So who are they? Who has positive history of breast cancer in the family, like first degree relative. First degree relative means mother or sister or brother, like this. It's very rare, but mother or sister who is suffering from breast cancer, that is first degree relative, they come under high risk group. And if multiple second degree, like grandmother, Masi PG, I mean RDs, if they are suffering from multiple secondary relatives, if they are suffering from breast cancer, if there is any known genetic mutation which are associated with the breast cancer, like BRCA1, BRCA2, PTEN, multiple other genes are there. If there is any known genetic mutation. Number 3 is that if there is any previous history of breast cancer, they are under the very high risk group. If there is any previous history of radiotherapy to the chest, any childhood cancer or any reason that person has received radiotherapy in the childhood at the age of 10 to 30 years, I mean between the age of 10 to 30 years, then they have more chance of breast cancer, like this. So they are high risk group. So for that, all this screening program they have to follow, along with they have to do breast MRI yearly. In that case a mammography is not required. So breast MRI will be sufficient, and that will be started from the age of 35 years. Now this is some picture I have put. Okay, this is the picture of mammography and breast ultrasound. When do we do breast ultrasound? Normally mammography is indicated. Even in pregnancy situation also mammography is indicated. In mammography we use very, very low dose of X-ray. Initially it has been we used to follow that in pregnancy situation we shouldn't do any examination which is associated with X-ray. But in mammography, we use so low dose of X-ray that even pregnancy also, according to NCCN guideline, you can use mammography during pregnancy situation for screening. But still we prefer, because it is still unknown, though they are saying, but we prefer breast ultrasound in pregnancy situation till now. And these things when there is a dense breast. So in case of dense breast, so a mammography is not so much clear. So in those situations, we prefer ultrasound breast. Needle biopsy is required when there is any suspicious lesion in the breast. In the imaging, either in mammography or ultrasound, we find something, then we advise for needle biopsy. That is the main confirmatory investigation for breast cancer. Now, when should we stop this screening? There is no age limit to stop this screening because cancer incidence is increased with the age. So there is no age limit. But if there is life expectancy less than 10 years, lots of comorbidity, and after the age of 80, we usually do not offer very aggressive disease. If we cannot offer any curative treatment, then there is no role of screening. So usually after the age of 80, or when there is life expectancy less than 10 years, usually we advise to stop screening. Now, what are the risk factors for breast cancer, which you can avoid? But the risk factor is these are very tricky, like age. Aging is one of the risk factors for breast cancer. Female gender, which you cannot avoid. Family history, personal history of breast cancer. Reproductive factors like early age of menarche, that menstruation started in the very early age, and late menopause, and first childbirth after the age of 35. I mean, nowadays it's very common because of this modern life and everything. People are usually, this pregnancy and all these things they are doing after the age of 35, and that is one of the very big risk factor. And another thing is that nulliparity, infertility, all these are risk factor for breast cancer. Hormone treatment. After total abdominal hysterectomy and oophorectomy, sometimes patient is having problems, so usually advise hormone therapy for those patients. So this hormone treatment may cause alcohol consumption, obesity, smoking, all these are risk factor for breast cancer. For breast cancer, initially first 5 to 6 risk factor we cannot avoid, but we can avoid smoking, we can avoid alcohol, we can avoid obesity, everyday physical activity, and all these things usually prevents breast cancer. So healthy lifestyle. Chemo prevention nowadays we are not doing because this is some dicey result regarding chemo prevention. That means anti-hormone therapy nowadays not so much popular. Healthy behavior, weight reduction, exercise, all these things actually helps to prevent breast cancer. And if there is hereditary breast cancer or known genetic mutation, then bilateral mastectomy can be done. Everybody knows about Angelina Jolie. She was positive for BRCA1 mutation. So she did these things, bilateral prophylactic mastectomy and all. So before finishing my talk, I'll tell you a few things that is very, very important, that you shouldn't believe everything about breast cancer. And there are lots of myth going on, and people doesn't know about these things. So you should know the truth, that these are the myths, that breast cancer is more common in women with big breast. That is not true. Usually big breast is associated with the obesity. That's why there may be some risk, but otherwise there is no risk. No risk means there is no higher risk. Everybody, all of us are in the average risk group, but because of these things, big breast, this is not a extra any risk. So pain in the breast, most of the time patient who is coming for this screening, and almost of the time they have this question that I'm having this pain, and is there any chances of breast cancer or all these things? No, it is not. Only 1% of breast cancer is associated with, less than 1% actually is associated with pain in the very initial presentation. Most of the time it is painless lump and all these things. Okay. And the pain is most of the time is associated with menstruation or any other, or if there is someone is in reproductive phase, in pregnancy, and also there may be breast engorgement, it's growth in the breast, so there may be some pain, but it is not at all associated with that. It is not a risk factor, or it is not a primary symptom for breast cancer. Only women with a family history of breast cancer are at risk. No, it is not. All women are at risk of breast cancer, and average risk. when there is family history, they come under this increased, high risk group. Most breast lump are cancerous. No, this is also not true, because most breast lumps are non-cancerous, benign. Some of them are cancerous. There are some features which we can find during mammography. If there is any microcalcification, if there is any speculation and all these things, then we just call it there is suspicious lesion, then we advise for biopsy and all these things. But otherwise, all the breast lump, they are not cancerous. Caffeine and sugar cause breast cancer. No, it is also not true. Sometimes sugar is associated with obesity and all these things. So that's why we ask the patient to take balanced diet, not more carbohydrate and all these things. Annual mammogram expose you to so much radiation that they increase your risk of cancer. That is also not true, because it has been proven that the dose of X-ray is so low that it will not increase your chance of cancer. And it always outweighed the benefit of mammography than its harm. So it is very, very important to do breast cancer screening, because now the situation is very grave. It is, increasing day by day. So if we can detect it in early stage, or if we can prevent it by following the healthy lifestyle and all these things, that is the only way we can fight this cancer. Now, thank you. If you have any question, please ask.
So it was a wonderful, insightful, and I'm just shocked to learn that it is as early as 20 years old. We should be aware about the screening even at early as between 20 to 25 years, as ma'am said. So it is really shocking. And I would like thank ma'am for such an insightful talk and to break all the myths regarding breast cancer, which most of us women have in our mind, that we can't do this. If we have this, we might not have cancer. So there is no such, we cannot have any biasedness in our brain. So thank you, ma'am, for breaking all the myths and for highlighting us with such an insightful presentation. I would request if any participants has any question, any query, they can unmute themselves and just ask the question to ma'am. We have 6 more minutes to before the session can end technically. So do we have any questions? I guess we don't have any questions. I will like to thank ma'am for making time from her extremely busy schedule. As she was saying today that I have to rush back to home because she has the tumor board meeting in KIMS hospital today.
Yeah.
Every Tuesday, there is a tumor board meeting which extend up to 6:30, and she stays so far away from KIMS, and so she informed me that I have to rush back to home just to be ready about the seminar, at least so that I can be ready 5 minutes before the presentation begins. So thanks a lot, ma'am. I know that you are very tired, but still you managed, and we are still in the breast cancer awareness month. That's the most important thing.
Yes,
And
that
we
is
managed to yes, we managed to conduct this seminar just before it ends, just before it's 12. So the awareness is not only about the month of October, but throughout the year, as ma'am said, even during pregnancy, we should screen ourselves. And there are modern techniques where the dose of radiation is very low, which won't harm us. And we can, like after 6 months, after yearly, we can screen ourselves. And physical examination from a proper hospital by a trained clinical person is very important. Rather than just doing it at home, we can go and we can seek help from a clinician who is trained on this physical examination, breast examination. So I think somebody has questions. Yes,
Yes.
you can go ahead.
Yes, good evening, ma'am.
Good
I
evening.
just wanted to ask that if a person has a lump in her underarm for like several years, maybe that is something that has started from her early childhood days, okay. That's
Okay.
not really painful at all, but the lump is existing. Now,
Hmm.
is that because of fat accumulation, or can there be some other reasons for it too?
Yeah, that may be due to fat accumulation or something like that. Because if it is something other than this benign thing, then it will grow. It will not be like this, and it will not be there for so long time. So if it is there since childhood, then it may be just some growth, I mean fat growth or any tissue. I mean, if, even fibroma, lipoma, multiple other benign tumors are there, it can be. But if that person is in between this age, between the 25 to 40 years or more than 40 years, then definitely I mean, she should undergo screening. As I have mentioned here, that if in
Okay.
younger age, then every 3 yearly, that she should be checked by any oncologist or any center where there is a this screening program is going on, or if she is more than 40 years, then annual screening is mandatory. That is important.
Right, ma'am. So it is something that has been there for such a long period of time, then I think that's like it's not in the risk zone. That's what you're
Yeah,
saying.
yeah.
That's not
That may not be the thing. That may not be anything related to cancer. That may be something benign tumor.
okay, ma'am. Thank you so much, ma'am. Thanks a ton.
Thank you.
So thank you so much, ma'am, for this wonderful session, for such an
Thank
insightful
you.
talk.
I
And
should thank you because you took this initiative and you are doing this thing, and that is commendable. I should thank
it's
you
from,
too
the
also,
initiative is
because
from
we
Team
should
Exsure.
spread this. We should spread this to
Yes,
everybody, because
definitely.
as I told you that we are all under the risk,
Exactly.
every woman. So everybody should know about this. I mean, about breast cancer, about all these things. So thank you.
Thank you so much, ma'am. So this is all from, the initiative was from the whole team of Exsure. And so
Okay.
yes, thanks a lot. We will be sharing this, since we have recorded this, we can share it everywhere, and we will share the link with ma'am as well, so that she can share it amongst all the groups and to become much more aware about this. So yeah, I would like to, because we have less than a minute, the meeting will automatically closing. So yes, so thank you so much. I would
Thank
request
you.
everyone to leave the meeting.